morning, everyone. I see we're just waiting for some folks to join, get connected to audio. And then we will be getting started promptly because we have a lot of ground to cover this morning. Eunice, how are we doing on our numbers?
This woman is, and I apologize deeply, but we don't need chairs at this moment. I need to figure out how many chairs we need, and we'll probably need some other stuff too. And I'll put in an order from me.
If you are on the webinar, if you could please mute yourselves, that would be very, very helpful. Thank you so much. Okay. All right, I think we're a minute or so past the hour. Perhaps we can get started and we'll have other folks joining us perhaps in the few coming minutes. But wanted to welcome you all. Good morning, everyone. My name is Alex Blanford. I'm Program Director with the Council of State Governments Justice Center. Welcome to the webinar entitled How the American Rescue Plan Helps Criminal Justice Stakeholders Respond to Behavioral Health Crises. So if you were intending to join this webinar, you are in the right place. You do not need to get off the plane. It is hosted today by the Council of State Governments Justice Center and in partnership with the Center for Healthcare Strategies and supported by the Bureau of Justice Assistance. And we'd also like to do a special thank you to the Office of the Attorney General. We had a special advisor from that office. It was incredibly helpful, as there's lots of information to distill down for folks in the field. The purpose of our webinar today is really intended to introduce local criminal justice stakeholders to a way that funding through the American Rescue Plan can help support collaborative crisis and early diversion responses with the ultimate goal of reducing criminal justice contact for people who with behavioral health needs. We are going to focus on our webinar today on what criminal justice stakeholders need to know to access new opportunities, what we know right now as of today on June 15th about where things are and where things stand, and also give you some advice, some tips, some strategies to help ensure that resources are reaching the people who need them most. And that you're able to, in your community, form effective partnerships in whatever way that looks to meet your own needs and priorities locally. Speakers will also highlight effective ways to advocate for local needs or how to represent your needs, especially for programs where there's considerable degree of state oversight. So we're going to be doing a little bit of a dive on Medicaid in particular to help sort of contextualize how that program works, how you can understand what decisions are being made and how that might sit or look in your state. So slide 2, if you could please move us forward here. Thank you, Eunice. So this is specifically how we're gonna spend our time together this morning. So I'm going to give a very quick, hopefully quick background and just setting our stage for our time together and give you a very quick overview about the American Rescue Plan itself. Then we're going to turn to speakers who I'm thrilled are with us here today. Thank you, Eunice, who are joining us to represent state, local, national perspectives. And they're going to share to help contextualize the conversation for us about where they are in this process and what they're working on in their states. Some of the biggest questions that they're wrestling with, who are they talking to, and different things, what they're working on and how this is unfolding for them in real time in their states to help contextualize the context. Then we're going to dig a little deeper on specific strategies. We're going to talk a little bit more in detail about mobile crisis, for example, and what are these components that are so critical as we talk about building crisis systems and where communities are asking for support. And we're gonna highlight where you can look for some more information and some key things to think about related to those specific strategies. And then we'd love to leave some time at the end to share some more additional resources where you can go for more information, especially as I said, things keep changing and new guidance is released. And have time for questions and answers too. So actually related to that, a little housekeeping note, if you could submit any and all questions that you like in the chat function of the Zoom, and we will be collecting those throughout the course of the webinar. We may be able to just answer some of them directly and send you a link to a resource or some information. And then for others, we will hopefully then have some time at the end for ones that maybe have a bit more, lend themselves to more robust discussion, or at least a little more discussion so everyone can hear the answers. And then of course, if there are questions that we don't know the answers to, we will do our absolute best to find out what that answer is and follow up with you. So please encourage you to take good use of that chat function, because we really want to hear what you're thinking about and what questions you have along the way. Okay, if you could, so our speakers, I'm going to have them introduce themselves actually when you hear from them, but just to highlight who we have joining me today, I have Mark Larson, who's the Senior Vice President of Leadership and Capacity Building for the Center for Healthcare Strategies. Mark comes from a very impressive background in terms of having a unique vantage point for our conversation. He was not only a Medicaid director, but was also a legislator, state legislator, and then also worked in human services and correctional work. So I'll let Mark can speak more about that, but he has a very, very unique perspective and lots of insight, especially on our Medicaid conversations today. So really thrilled that he's here. We also have Steve Allen joining us from the Oregon Health Authority, who is the Behavioral Health Director. Steve also comes from, I know, a lot of background in corrections, state, local. I actually had the pleasure of working with him as a colleague here at the Justice Center for a number of years before he went to Oregon, and I'm very excited he's able to join us to tell us more about the work that he's leading there and how that work is unfolding for him at the state level in particular. And then thrilled also to have Brenda Pena, last but not least, who's the Deputy Executive Director for the County Commissioners Association of Pennsylvania. In that role, Brenda does incredible amounts of work to represent sort of policy and advocacy on behalf of county commissioners, and works across all different local partners and lots of different players, as well as with the state. And they have a specific focus within CCAP on reducing contact for people with behavioral health needs in the criminal justice system. So near and dear to our hearts. I'm really, really excited that she's here today as well. So if you can move to the next slide, please, Eunice. Very, very quickly about who we are, the Justice Center. If you're not familiar, we're a national nonprofit organization. We have sort of a membership organization. We also serve state officials in all three branches of government. We also do an incredible amount of work locally. We're one of the three main partners in the National Stepping Up Initiative. In case you've heard of that initiative, we'll send more information. That seeks to help counties reduce the numbers of people with behavioral health needs in their local criminal justice systems. If you can move to the next slide, Thomas. We also have, as I mentioned, Mark from the Center for Healthcare Strategies. Center for Healthcare Strategies is a wonderful partner for us because they really can help represent especially the health perspective and really bring in cross-system focus on how to tackle these problems. We are all trying to serve the same population at the end of the day. So the Center for Healthcare Strategies has brought us a ton of expertise over the years in partnership and working focused on national policy, how you can focus on low-income Americans getting access to care through lots of different mechanisms, delivery system reform, integrating services, and really, really building leadership capacity and capacity through Medicaid. So Mark's going to talk a little bit more about that too within this context. Next slide, Eunice. We're thrilled today that we could bring this webinar to you through the Bureau of Justice Assistance. And here's a slide here about who BJA is and what they support. And you can check out their website there for more information. I'm going to actually go to the next slide, which highlights a very specific program that BJ oversees. That is actually the program that's supporting this work today. And there are some new open opportunities for funding actually through this program that I'm going to speak about at the end of the webinar to give you more of those details. But it's a justice mental health collaboration program. This has been a longstanding program that funds, as the name implies, efforts locally at state level, tribal communities to help foster partnerships that are aligned with those communities' needs and priorities for public health and public safety, and helping support sometimes those services and supports and the work around collaboration that sometimes isn't otherwise funded through dedicated sources. So it's a very critical program, or the communities have used to help support those goals. Next slide, Eunice. Okay, great. Let's dive in. I'm going to start very quickly. If you go to the next slide, Eunice, we're going to start doing some setting of the stage here. So it's just some key points just to orient us in our conversation today. Again, our anchoring goal for the focus of our webinar today is to reduce contact with the criminal justice system for people with behavioral health needs. And we talk about this from law enforcement, of course, from the very, if you're familiar, of course, with the sequential intercept model, and the funnel, we're talking about the very, very top of the system, to jails, to community corrections, to courts, and wanted to have this webinar as a way to target criminal justice stakeholders, as everyone is kind of touching one part of the elephant as it relates to the needs of this population. And ARP represents a lot of exciting opportunity to potentially support infrastructure and strategies and programs that some communities have already been testing or working on, and to expand and scale others that are maybe working well already in your community, or just to address gaps where there isn't a certain service or model in a community. So wanted to offer this webinar as a way to start the conversation, as there's so many resources out there and so much information in real time, but just to bring us all together to focus on what local criminal justice stakeholders can do and what their role can be in partnership with other systems, with their counterparts, to really help break this cycle. And to do that, we're focusing on two specific strategies. So we're going to focus the bulk of our time today in how the ARP can, in particular, support communities in building comprehensive crisis response and early diversion systems for people with behavioral health needs. And then, of course, as crisis is already in many cases too late, or we need also some more upstream and downstream support to ensure that people, you can mitigate and respond to crisis over time and improve the well-beings of communities. So we want to focus as well on supporting the broader community-based system and the underlying healthcare and support system that might be available and that can be leveraged through ARP funding to meet the needs of this specific population as well. So people are connected to longer-term care that can hopefully mitigate them experiencing future crises and having unnecessary contact with criminal justice, with law enforcement, with shelters, with emergency rooms, and just reduce the over-reliance on those services that system or communities are feeling. And of course, we cannot not mention, this is also within the backdrop of a pandemic that has exacerbated existing gaps and factors that have driven racial inequity and caused more harm to communities, especially Black, Indigenous, and people of color. And the data from the CDC points to even higher rates of overdose death overall, also within certain communities that have been even more harder hit than was already the case pre-pandemic. So we're seeing elevated and hearing about elevated levels of adverse mental health conditions, rates of anxiety, depression, suicidal ideation, overdose deaths, substance use. So this is the sort of context where we are, important to ground that these opportunities are coming down the pike through ARP and how important that is. And also that there are more pressing needs perhaps now, and then how do you think about how to leverage these resources and partnerships to also support your longer term goals over time. So we're going to talk a little bit more about that as well. And I already mentioned this, but just to put another finer point, why crisis specifically? Well, again, we know crisis itself is already too late in terms of someone experiencing that, but we know that with rising crisis rates and the inability of communities to really meet the needs and have the resources to support the consistent building of these systems, then there is an over-reliance on other actors and other systems, such as law enforcement, again, and the emergency rooms, shelters. And so there is a need for, as many communities are doing, and some of our speakers are going to speak to, kind of looking towards a bigger, broader system strategy, and how can you think about how ARP can help support that. So actually, if you can go to the next slide, Eunice, this is what we mean when we say a comprehensive crisis strategy. So here is a few key points I wanted to highlight to ground our conversation. There's the essential components of what SAMHSA and Crisis Now and others who are really leading the way on these conversations nationally are defining as sort of critical elements of a crisis system. So of course you have your call center that is available at any time, but then what happens with that call? That's where mobile crisis comes into play, and the ability for people to meet you where you are and who's leading that and what roles those look like. And then of course the stabilization side and where that can be, if that can be at your home, if that can be in a brick and mortar facility like a crisis stabilization unit. And then of course within that doesn't all just come together by itself. We need to also have partnerships in place that are right and appropriate for that community and their needs. That's where law enforcement can come in. That's where other community-led and other community-based organizations are already and can also play roles here that are really, really pivotal and will continue to increase, which is very exciting. And then we also have just the care and services that people can actually get, and what does that look like? So these are, peer-led services, the important role of all these components to make this work correctly. And then if that wasn't already enough, I know it's overwhelming, that is really the response side. We also wanted to put a finer point in this graphic to highlight that whatever strategy that you have, of course, you need to have the ability to respond, but there's also a way to think about more prevention and more upstream activities that can happen in communities and what that can look like. And of course, those connections into the broader systems of care too. So you're hoping to break that cycle essentially. And next slide, Eunice. Wanted to show on this slide just a more finer point too on what we mean by diversion. So of course, crisis itself represents opportunities to certainly mitigate a person's likelihood of being arrested or to have that criminal justice contact in a crisis situation. But we also want to be thinking about broader diversion opportunities too, that of course, if someone has that initial contact, as criminal justice stakeholders know firsthand, that then can mean deepening contact in lots of different ways that is very harmful, cutting off connections to community services, if they're sitting in jail, lots of different issues, of course, that can come from that initial contact at crisis. And we wanted to put a finer point too on looking across all the criminal justice systems as well, and how stakeholders can think about what those off ramps are and how they can be further supported by new resources like ARP and others, and how the community can have a direct input into what their needs are and what their most pressing gaps are to meet those needs. Next slide, Eunice. Great. So as communities are considering their public health and public safety priorities and needs, they're looking for more adequate and flexible funding strategies, which has been, I think that's always the holy grail, but certainly more so now than ever. And so what we wanted to do is to use at least this webinar to talk about what that could look like under the context of ARP, because it is the most significant infusion of resources that could be used to support some of these goals in recent years. So if you go to the next slide, please, Eunice. I wanted to just give a very quick overview of what ARP is. Passed in March 2011, intended to help provide resources to communities and states to mitigate and respond to ongoing challenges of the pandemic. And then, of course, as I mentioned, this is under the backdrop of other challenges and harm that had happened to communities that was even, it was just exacerbating existing gaps and challenges that they were experiencing, not having enough housing, not having enough access to care, all of those things. But so through the ARP, there's certainly there are large investments that could be or are intended to help increase access to healthcare treatment and services, whether it's not necessarily specifying for people in the justice system, but of course, if you build up that broader system of care, we don't want to build parallel systems, so that there's certainly more opportunities there. More than $2 billion to invest and incentivize states for crisis systems and diversion opportunities. We're going to go into more detail about that. So I want to direct you actually at this time to a handout that we put together that was, it's very detailed, and it's our attempt to put together in one place some of the key funding strategies and key considerations around who's eligible, how long are these funds available for, how might you expect to receive those funds, and then some key considerations for you that we're going to go through in more detail. But wanted to first direct you to that handout, which is in the chat. Thank you, Thomas. Thomas, my colleague, Thomas Coyne, who I did not introduce, but has been behind the scenes helping me with the webinar today. So you'll see his name popping up. He sent that handout out, and we're going to go into more detail on that, but I wanted to orient you to that now. And essentially, in a nutshell, which is very difficult to do with the American Rescue Plan, but I'm going to attempt. There are different types of funding sources that are most relevant in this conversation right now. So there are some that are available right now that are more sort of time limited, intended to be addressing those critical gaps and needs at this present moment. So of course, some of the local and fiscal recovery funds are going to be in that category. And some of those funds are available directly to state governments or to state or local entities, versus others that are the more programmatic side that are going to be distributed through existing programs, of which we're going to highlight many, or in some case it's created a new source of funding, but it would still be administered through a federal agency and go through a sort of programmatic disbursement. But we'll talk a little bit more about what that means. So just important to know there's money right now that's sort of for immediate challenges and how communities and states are thinking about that. And then there's these other resources that are going to be coming available over the course of the next coming years, some of which are already becoming available, with others that are coming down the pike. Also, what that then means is that state and local entities are going to have very different roles in determining the extent to which ARP resources are leveraged and how some of those resources can be accessed directly at the local level again, versus where there are decisions or responsibilities that need to be met in terms of state agencies to manage and make sure that opportunities reach folks. And we're going to talk in more detail about that, what that means for Medicaid specifically, because I think that's really an important place to unpack that, especially as there's a lot of opportunity coming through Medicaid for mobile crisis. Before I turn it over, though, I wanted you to hear a message, which is an important message. Everyone is in a very different place. We don't want anyone to be discouraged by how much is out there or how to put it all together or where to start. Depending on where you are, you might be sitting in a place where you're already connected to an existing initiative, or you already have a connection to the state Medicaid agency and have been able to talk to them about the needs of this population directly. But if you're not, that's okay. The intention here today is to just give some tools to have in the toolbox, and a lot that is unfolding in real time. If there's just one thing that you could walk away with today as something you could read or bring to your team or use as a way to engage a state counterpart and know who that is, then we'll be we will have at least done a little bit of our job, but also, we're not going away. And I'm going to talk as well about some other technical assistance that can be available on an ongoing basis to help you through this work. So with that in mind, I'm going to now turn it directly to our speakers because I think I've been talking long enough. I'm going to turn it to Brenda Piniak first. And again, she is going to speak, and then Steve Allen as well, to give their context about what these opportunities are really looking like what collaborations can look like in the context of where they are in their state's respective efforts, and what they're really thinking through as critical issues right now as it relates to ARP, in service of this goal that we have of reducing criminal justice contact for this population. So Brenda, I'm going to turn it over to you. And Eunice, if you could pull the slides down so everyone could see Brenda's face, be a bit more conversational, that would be great.
Good morning, everyone. It's so nice to have this opportunity to talk with such a large array of interested folks from a variety of different perspectives. My name is Brenda Piniak. I'm the Deputy Executive Director of the County Commissioners Association of Pennsylvania. And the counties, like everyone else, are in somewhat scramble mode to figure out what all is out there, all of the different resources, how they fit, and then how they kind of interact with some of the direct funding that counties received from the American Rescue Plan and the CARES Act previously. So I think one of the things that's helpful for folks to understand is just because we have all of these new resources and just because we've been kind of redirected by the pandemic and all of these 15 months later still working our way out of that, the things that we had on our plate beforehand didn't go away, and in some cases they actually became worse. We had people who were not seeking care and treatment during the pandemic because they didn't want to interact with outsiders, and they may have found that their conditions were declining, and all of a sudden families are needing resources that they hadn't sought out before. So what we were doing before was important as well. We were looking at ways to make sure that we were redirecting populations with behavioral health needs to other resources at the county level. And we were doing that through a variety of sources, mostly through participation in opportunities presented by our state governments, or in homegrown opportunities where we didn't wait for state government, but we went and we said, look, we think we've got a role in this and we'd like to talk about that. So we are now kind of going back to where we were, fitting that in with the new world or the new realm that we're all experiencing post-COVID, trying to take advantage of what we learned during that time and maintain some of that, and then continue to move forward with some of the resources that are out there. So what I mean by that, as an example, we found that a lot of county jails had reduced their populations dramatically during the pandemic. So now you ask yourself, when you're coming to the other side, what was it that allowed them to do that? Well, there were some diversions that were placed in the way as we went forward, and there were things that our judiciary started to do in collaboration with our other county services like county mental health and county adult probation that allowed for those reductions in population. So wouldn't it make sense to figure out what of those things could be continued going forward as a means of reducing the impact of incarceration on our behavioral health populations? So we've started to explore some of those things, and in some cases it's just making the obvious more obvious. There might be things that you are looking at, but you don't think about them in terms of a long-standing practice or principle. You think that was COVID related. Well, maybe it wasn't COVID related. Maybe it was a way that we all decided to find new ways to conduct business that should be maintained long term. So in Pennsylvania, we have all those different resources financially. We have the CARES Act, we have the ARP funds, we have the specific ARP resources, and then we have the funds that came directly to counties. Also in Pennsylvania, we have $7 billion that's going to be available to state government to figure out how to address state and local needs through our appropriations process. So the commissioners, for quite a while, were waiting for information in the form of Treasury guidance to determine how they could spend those funds. They're starting to get that information now. They're also looking carefully at whether or not the county-directed funds should be used to either incentivize other funds that are out there, or we make sure that we want to use directed funds first. So if there are programs, you can identify them through the handouts that Alex has made available that are for a specific purpose. Can you then further advantage those dollars by using them strategically? Can you think about how the long-term impacts of those things could be more effective beyond the term that those dollars are available? So that's kind of where we're at the county level right now. We've got a lot of work to do, a lot of education for commissioners, a lot of new contacts that we're making with our state government partners, and a lot of new contacts that we're making with some of our untraditional community partners to make sure that we're all at least on the same page, trying to plan to use those resources in the best possible way and make sure that they have a long-term impact. So that's kind of my general overview of where we're at right now. Alex, am I going back to you, or are we going to the next speaker?
Yes, actually. Yeah, so Brenda, I think we might have some more questions for you, but we can unpack those in the next strategies discussion. So I think I will turn it over to Steve Allen, and then do you have anything else you wanted to add, Brenda, before you do that?
I think I'll stop at this point, but thank you. Looking forward to the next segment.
Sounds great. Steve, I'm going to kick it over to you.
Yes, thanks, Alex. Good to see you again, Brenda. So I'll talk a little bit about what's going on in Oregon, but I thought it might be helpful to think about a framework for engaging the state. And as local governments, you have resources that are available to you, including increased resources that are attached to these new federal initiatives. But clearly, there's a role for the state when you want to, amplify or increase investments or create additional stability of investments. And so I thought it might be just helpful to sort of talk through these. And in staying aware that you've seen one county, one local government, and one state. There's a lot of variation in all of this, but I think the themes remain pretty constant. So I think one of the first things is just to start out is where are interests aligned between local and state governments. And there's a number of different intersections there that I think are really important. Another is what I'll just call for this purpose, the color of money, and I'll describe a little bit more what I mean by that, but it's essentially the language right now that there's a variety of new and existing funding streams that can be brought together to be woven together or to think through how best to leverage what resource for what purpose. Thinking about the long game, so the ARP funds allow some initial surge in funding for certain things, but how do we sustain those investments so they have a long-term impact? And then access points to state government, whether through the state agencies, through legislators, through the governor's office, et cetera. I think those are all important. In terms of aligned interests, I think right now, key areas where we see important relationships between state, local government, and shared interests, one of those is the crisis system that Alex was talking about earlier, and specifically what's the 988, which is coming online in July of next year. But more importantly, not just the access line itself, that is, of course, the behavioral health version of 911, 988, the crisis line for behavioral health that's going national, but the infrastructure behind it. So mobile crisis, mobile response, in most places, there's existing infrastructure, but clearly in most areas that needs to be bolstered and strengthened, and how to best do that, because that's all locally done, locally equipped. Integration with existing call lines, the crisis receiving centers, crisis stabilization centers, bricks and mortar alternatives to emergency departments or jail. Clearly, that's also a local effort, and how to align interest for that. What's going on in state hospitals as competency restoration populations increase nationally. Running state hospitals is extraordinarily expensive, and many of the hospitals across the country, including here in Oregon, are becoming forensic hospitals, excluding civil commitment populations. Is a huge impact of that, and as states are working to respond, this is clearly a crossover between criminal justice populations and people with serious behavioral health complications, prison populations, frequently some level of justice reinvestment initiative going on, frequently with a focus on behavioral health. Opioids responses, drugs, methamphetamines, they're all challenges here in Oregon and in many places across the country. And I don't want to exclude health equity and racial justice as key themes that many states, including Oregon, have really leaned into. So provide opportunities to really create some dramatic shifts in how systems operate, which can also, if done properly, improve health outcomes for everybody. So those are key themes where there's interest in states across the board. The color of money is really about understanding where ARPA funds can fit in, and of course you have access to some at the local level, broader access at the state level. Right now in Oregon, there's a lot of consideration given to what of new funding initiatives, including those in behavioral health, can be funded with one-time monies, and what do we need for ongoing operations once those are funded. So if you think about the long game and how to best leverage those ARPA funds for, say, one-time infrastructure like bricks and mortar buildings, data infrastructure, we're looking at a workforce surge here in Oregon because our behavioral health workforce has really been depleted. It was impacted. It was not enough to meet needs prior to the pandemic, but we've also been losing healthcare workers through the pandemic because, frankly, folks are pretty exhausted. So how do we sustain the workforce we have and then take away financial barriers using ARPA funds such as tuition reimbursement, loan repayment, that kind of thing. Other funds to be aware of is sort of general fund tax money. That's precious resources because it could be ongoing if it's built into budgets. Medicaid funding, which I know Mark is going to talk some about, so that can be a really important source of funding post building up infrastructure. Block grants have been increased and some special focus on crisis stabilization or crisis resources, and then local investments, which are available in some areas. And then the access point, where you see shared alignment is that connections with legislature, and some county local governments in some states have really great impact on legislative decisions, and so there's opportunity to sway that. That's certainly the case here in Oregon. Directly with state agencies, it appears, we'll know here in the next week, that at OHA, the Oregon Health Authority, we will have access to funds to push out in grants, and so local governments will have an opportunity through an RFP process to submit requests. We'll probably send out planning grants to help support those efforts. So long story short, a lot is going on in these spaces right now. I think there's also a lot of opportunity for local governments to join in to these efforts to benefit from those. And as a state government, we have problems that we are looking to help to solve, and we absolutely need local governments to support those efforts. And so it has to be a partnership. So looking for alignment, looking for how best to fund or braid funds, leveraging the ARPA funds as appropriate, and how to think about sustainability for these, I think all play important roles in these conversations. So thank you. Turn it back to you, Alex.
Thank you so much, Steve. That's wonderful. I appreciate you both sharing your reflections. I think on that note, let's dig in. Let's dig into strategy one, and let's have some more discussion about what some of these considerations you've mentioned look like in real time. Also, just want to encourage folks, if you have questions, again, you want to share, please put them in the chat, or if you're feeling a little shy and you just want to send me a private question, no problem. Whatever makes you feel comfortable, but we do want to hear from you. So if you can, Eunice, pull back the slides if you, yes, thank you, you're already on it. Next slide, please. I think we've covered this point. Next, please. Next again. We are getting, oh, next again. We didn't even need that slide. Okay. Yes, next one. we like to get a lot of intro, don't we? Here we are. Okay, so again, we're gonna be focusing on strategy one, which I think if you click on it next, it'll light up in a fancy way to show that we're highlighting it. No, okay. Well, keep going. I'd like to get to the charts. Yes, there we go. One back, please. There we go. Okay, so before we dig in, just wanted to ground us a little bit. If you're looking at that handout, again, this is a very oversimplified representation, but wanted to give some way to categorize or organize the ways that we're seeing how these resources are relevant to different pieces of this conversation in particular, or specific components, I should say. So for the crisis response, we've done our best to sort of light up in your chart, and as you'll see on the slides, what resources are relevant to these different pieces. So we have the crisis call center component, we have the mobile crisis response, and then we have the crisis stabilization component. And then the purple icon refers to anything else. Of course, if you create a crisis system that can help obviate contact with law enforcement where it's not necessary, then of course that unto itself is a diversion system. But we also wanted to highlight other ways and other mechanisms that could provide some other possible opportunities to think about how to divert people from jail and from deeper criminal justice contact. And then of course, the second strategy, which again, we won't go into much detail today, but it's just as critical, so it gets the same amount of real estate, is how do you build the capacity of and connections to the broader community care system. So if you could go to the next slide, Eunice, we're going to start right away with, if you want to follow along with your handout, that's okay if you want to look at it later, but I want to elevate a few key resources. So next slide, Eunice. Here we go. Okay. So first, when we're talking about the different opportunities that are most relevant to building the crisis systems and diversion systems, want to highlight in the state and local fiscal recovery funds, which is this part of the resources we've been mentioning, and as Brenda spoke about, that are available now for county governments. And so you can see here, or I should say state, local, and tribal governments are eligible for these funds. So in this chart, the way to best look at it is you can click on the link itself to bring up the relevant ARP or language in the ARP Act, if you'd like to see the provision language and how it was framed. Then it also has a reference to a specific section. It has the total amount of money, and it has a brief description. And then we also have here who's authorizing or who is administering the funds, which is also the place to look. So if you aren't sure what the latest is of what updates are, you can go to that organization or that entity, check their website. That would certainly be where any sort of new guidance or rules would be. And then the next column is who is eligible based on what we know from either the ARP language itself, or if there has been other guidance issued, as is the case with the state and local fiscal recovery funds, where there's helpful to know if there's more nuance of eligibility. And then the last column is how does that money reach the people who are eligible or the entities that are eligible, and they're through different mechanisms. And then of course the date by which those resources are available. So in some cases, it's something that's authorized till the end of the ARP Act, which is 8 years. And in other cases, as you can see here, these funds are only available until May 22 for these immediate recovery funds. So I wanted to give you an overview of how to read the chart. And now I'm going to just give you a quick overview of the key things that I think or we'd like to raise as being most at play here when we're talking about mobile or these broader crisis systems locally. So the state and local fiscal recovery funds, there is language in there that could reasonably be leveraged within the eligible uses that includes providing behavioral health services, hotlines, and crisis intervention. There's also supplement pay for essential workers, which could also include social services workers who might be doing some of this work. There are, and I want to direct you here to the specific guidance, which in the chart we list, we link to that directly. So I think Brenda, you had mentioned that we were anxiously waiting for this to come out, and it did, and here it is. So this gives all the language for who's eligible for what. There's more detail on eligible uses, but the main story, or what I want you to take away, is to talk to your local government or find out from based on who is eligible and who's listed, explore how your community is approaching this. I think, Brenda, I'd like to ask you to maybe reflect a little bit. I'm sure you can speak to this from what this is looking like in Pennsylvania, but it's a direct application process. And so this is a place where you could hopefully find out who's applying for this and what are the plans or the concerns about how to use some of this funding, and how are ways you can leverage it in the short term, but again, as Brenda said, to think about broader sustainability. The next source of funding that I wanted to highlight is the funding for expansion grants for certified community behavioral health clinics, which is quite a mouthful, but it is CCBHCs is the shorthand. And essentially I wanted to highlight, I'm highlighting them twice, but the CCBHCs, it's a model that's very exciting because it gives providers the ability to build broader community-based services within this model. So one of their required services is actually to provide mobile crisis services. And that's always been the case. But most relevant to this conversation is that there will be more money available for existing and presumably new providers that could meet the criteria to be a CCBHC, and that would not only be able to leverage those funds to provide or fulfill their function in serving mobile crisis services, but also CCBHCs provide a much broader array of care post-crisis as well, and even in preventative ways, that's really, really critical. So they could be very helpful partners. And actually there are resources that we will share. Thomas, if you don't have it handy, there's a resource on how law enforcement in particular is partnered with CCBHCs on this front. And we're going to be doing a webinar actually on CCBHCs as well later this summer. So stay tuned. We're going to do a much deeper dive. But what's important to know now is there's a link in the handout if you want to find out where are the CCBHCs in my community? Am I already working with one? Is there a center that might be interested in becoming a CCBHC and going after that money? And could that lend itself to a partnership with law enforcement to help relieve some of the pressure on how they might be responding in that community at that time with law enforcement? So it kind of presents new opportunities. The next announcement the next source, I should say, if you switch slides for me, Eunice. Aha, now this one, we're going to talk a lot more about this one. What's most important to know about the state funding option is this gives or authorizes states to be able to apply for mobile crisis intervention services. And that's the way it's framed in the ARP language itself. So essentially, Mark's going to talk a lot more about this, but the gist is that enhanced available funding, if a state approaches and applies for this state option, and depending on how the state approaches it, will mean whether or not all communities or some communities, or what that will look like in terms of access to these services. But it's a very exciting opportunity to also support more of the sustainability of services themselves through a program such as Medicaid, which plays a critical role there. So I'm going to leave Mark to talk about all the fun, juicy stuff there, but we're awaiting guidance from CMS. It has not yet been released. So in the chart, it gives you all the information if you want to know just sort of how are these services, what is a mobile crisis intervention service mean and how is it defined? It is all in there. But there's certainly some ways that potentially those resources could be leveraged or could help support or formalize partnerships, which could include criminal justice stakeholders, maybe even ways to share more information with each other, things of that nature, in addition to the services themselves. And then the last but not least, I think, or maybe we have a couple more, but this next one is just important to know that this is a new pot of money. This is a new planning grant that's going to be available to states. And it's intended to help them plan for how they would approach the previous option. So that money to plan is very, very critical. And so I would recommend that, once we find out what's going to be available for states and how, if any state can apply, that can provide maybe some more support for facilitating more of these sort of strategic conversations or ways to really plan and design the state's approach to the preceding benefit in a way that can help bring other voices to the table, and gives people more planning, the ability to plan, which is often, as many of us know, not always something that's as easily funded unto itself. Next slide, Eunice. I want to certainly put a finer point on the Community Mental Health Services Block Grant. This is an incredibly, it's a more flexible pot of money, shall we say, as it's compared to other sources such as Medicaid. But it, depending on what you know about the block grants, they've been around for many, 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 many years, but very, very needed. Let's say a boost in their funding amount is very, very welcome to help build the broader behavioral health system that I think we have seen firsthand, and especially in communities that haven't had consistent access to those services in the first place, where we really need to address critical gaps in that broader system. So the community block grants have gotten a significant bump in funding, 1.5 billion total. I have a list in the chart. You can find out exactly what the funding allocation is for your state. The guidance has also been issued for this, and also the substance use block grant, which I'm not going to spend specific time on here, but it's really critical as well to help bolster substance use services and to help states try and integrate that care. But important to know that block grants are going to provide states with more funding to focus on crisis services, and there is a specific requirement in this fiscal year that states do have a mandatory set aside for those funds, which I believe, I think it's 5% at least. So if you do the math based on your state's allocation, you can find out what your state is supposed to put aside specifically for crisis services. And of course, another piece of the puzzle, so to speak, to bring in as you're thinking about how all these different sources can help support different pieces of the puzzle or of the pie. Last but not least, there are some funding sources too under contract tracing and COVID mitigation that I wanted to highlight because I think it's really interesting for criminal justice folks to know that there could be other partnerships that could be really beneficial, in particular with your local public health department, to find out if there's ways to support further diversion activities, especially from jail, as part of congregate settings and the sort of dangers associated with having people in such close quarters and the elevated risk that people who are incarcerated do have in contracting COVID. So there is a clause in there that says mitigating the spread of COVID and how there could be opportunities there to determine how you could work or partner with your local health department to determine what that could look like for you and your community, even if it's just talking specifically about your jail and how your jail can work directly with your public health department. But much broader could potentially be those conversations as the public health departments are going to be rolling out systems to help, keep people out of these congregate settings, which certainly include criminal or incarceration. So now I'm going to turn it over to our speakers if they had any reflections or quick comments they wanted to make. They weren't already able to make up front just about some of these specific opportunities or some questions that they're wrestling with. And then I'd like to turn it over to Mark to tell us a little bit more about demystifying the Medicaid side to sort of give you a bit more ammunition or a bit more language on how to best partner with those counterparts.
Alex, could I offer a perspective on the mobile crisis units and their development? Again, avoid kind of that starting from scratch or getting overwhelmed by how to start and where to start. We know that counties have already made great progress in these areas with other resources that weren't directly available to them for this purpose. So that should be a great way to kind of get started. We know that counties have created co-responder programs that could be copied elsewhere, or even current co-responder programs, for instance, could be used and expanded to make themselves available of some of these funding sources. So if something's already in place, like I said at the beginning, think back to what you were doing before the pandemic hit and set us all aside and made us think in a different direction, and go back to some of those things and figure out whether they fit with some of these new funding sources. And then also kind of a general comment, if you're trying to solve your problem individually, you're probably making a problem for someone else. So whatever it is you do in your sector, try to be thinking of what other sectors are going to be impacted, and how some better collaboration might avoid that in the first place, because that cooperation is going to be what gets you the attention first. They're going to be looking for good collaboration. I know legislators, at least on the state level, are not looking to fund individual programs anymore. They're looking to fund collaborative efforts that bring all the parties together, whether that's grant funding or direct appropriation. And some of that is going to be true in how the counties look at working with their local collaborative partners.
Yeah, thanks, Brenda. Maybe I'll just build on that. I think that's exactly right. What 988 in this crisis work provides is an opportunity to strengthen something that's already there across the country, and it's this mobile response, mobile crisis. And what we find here in Oregon and have seen around the country is that these crisis services have often been underfunded and under-resourced. And so you might have crisis services that are available for a portion of the day or in a portion of a county, and because the teams aren't built out strong enough. And so within this work, sort of combining the ARPA surge in funding with the work being done on 988, the increase in mobile block grants, and the opportunity to fund these through Medicaid, we have an opportunity to greatly strengthen behavioral health response. And I know around the country, with efforts around stepping up and CIT, law enforcement first response have really been strengthened in many parts of the country. But still, when you look at it, what starts out as a law enforcement response for someone with a behavioral health condition can too often result in a criminal justice response as that moves forward, where you have the opportunity to lead with a behavioral health response, and you have the necessary resources, strong, accessible mobile crisis teams, well-trained, well-staffed co-responders models, or at least 2 providers accessible, and options like a crisis receiving center, where folks can drive up, drop off at someone other than an ED or a jail. I think now you begin to have a system that looks very different and can produce some very different criminal justice outcomes than you have before. Keep in mind, though, that none of these pieces without a back-end supports will have the full desired effect. So fully staffed mobile crisis combined with mobile receiving centers for those who need that level of care still need somewhere to go. So what I always ask the question, what happens next? Is it housing? Is it ongoing treatment? Is it addiction services? And so to not ignore or underemphasize the need for connections throughout the rest of the system. Yeah. Thanks, Alex. Back to you.
No, thank you both so much. I'm going to turn it over to Mark now, I think, to take us into unless there's other questions. I haven't seen any in the chat, but continuing to encourage everyone with a smile, if you have any. We're coming up to our Q&A portion relatively soon. But Mark, can I turn it over to you? I think certainly to sort of build, I think, a little bit on what both Steve and Brenda were saying, and to demystify the Medicaid side a little bit more for us too.
Alex, thank you, and thank you to Brenda and Steve as well. So I will try to just make a few comments related to the Medicaid perspective in hopes of making it feel easier to make some connections with those in the Medicaid world. Forgive me for starting off with just saying that Medicaid is a public health coverage program that serves individuals with disabilities, children and individuals with low incomes, and provides free and low-cost services such as primary care, access to prescription drugs, as well as behavioral health services, all of which in the context of individuals in the criminal justice system or individuals experiencing crisis are important services. And to the earlier point about shared interests, Medicaid programs have an interest in individuals relevant to our conversation today, and for a variety of different reasons. Historically, there's a concern about cost, right? I mean, these are some of the individuals who, within our healthcare system, frankly, cost a lot of money. But also, to Steve's earlier point about equity, there's an increasing recognition about the importance of looking at our health outcomes, and particularly where there are disparities in health outcomes. And so more and more Medicaid programs have an interest in collaboration, recognizing that they can play a role, but they're not going to be the entire answer. It may be important to recognize that Medicaid is a state-federal partnership. And why that's important is that the funding that goes into Medicaid comes partly from states and partly from the federal government. And in that context, states need to engage in ongoing conversation with the federal government about what they're going to cover, who they're going to cover, how they're going to pay for things. And that may mean that state Medicaid programs are restricted at times in terms of what's eligible for Medicaid financing. Recent new options for states around expanding Medicaid funding for things like mobile crisis is a good example of where over the course of time, Medicaid programs have gone from historically focusing more on medical services, doctors, hospitals, to a broader range of health and human services, particularly around behavioral health. In that context, it may be important to just comment that when approaching a Medicaid program about looking at how Medicaid financing, Medicaid dollars can be a part of the braided mix of funding to support a comprehensive system, obviously Medicaid dollars can only flow to individuals who are enrolled in Medicaid. And so an important conversation is how can Medicaid financing be a backbone of developing a system? But then how can we look at other payers, commercial plans, employers, and other state and federal dollars to be able to build around Medicaid as an underlying support system for the system. And there's often a perception that Medicaid programs have a ton of money, and they do. They are very large in their budgets. But a tip I would give is when engaging Medicaid as a partner, don't approach them as if they are the United Bank of Medicaid, where all you have to do is bring your deposit slip or your withdrawal slip to get some money. I suggest partnering with them around shared goals about improving outcomes, shared interests in terms of increasing quality of service, reducing disparities of health. I find that you will have a more productive conversation if you engage Medicaid as a partner at the vision and values level before you get to the specific dollar request. And let's see, Alex, I'll leave it there, recognizing our time. I welcome questions though.
Great, thank you so much, Mark. And actually, just to make an even more concrete element here is on the chart, I did, everyone has their own level of familiarity with Medicaid. And so if you're wondering sort of what is going on in my state, we've put the contact information, at least for your Medicaid agency, but certainly we can give more detail as follow-up, or if you have other specific questions, which you can certainly share with us about your state, and we can try and track down find out what we know about how exactly your Medicaid program is structured and what that might look like already for this population. So if there aren't any specific questions for Mark, I'm just going to give, oh, here we go. We have a question. Actually, I'm going to ask this to all of our panelists. And I have another question actually that I got that I was saving for our FAQ. But actually, I think this would be a good question to start with now from Corbin. How did your state or other states use the American Rescue Plan Act funding for one-time expenditures? So are infrastructure expenditures related to mental health, crisis stabilization centers, and mobile crisis centers eligible outside of the revenue replacement criteria? Any one of my panelists want to comment on how they're thinking about sort of leveraging ARP funds, how those conversations have been proceeding or will be unfolding in your state or locality for the infrastructure investments?
Yeah, I can jump in, Alex. So this is exactly how we're thinking about spending at least a portion of the ARPA funds, sometimes called sticks and bricks, bricks and mortar. I think it makes a lot of sense to do that. Here in Oregon, we have a shortage of some levels of residential care, children's residential placements, secure residential placements are in high demand here. These can either be a substitute for hospitalization, a diversion, if you will, or more often a step down from hospital levels of care for people. So those are the key kinds of residential type programs that we're looking to support. In addition to those that I was talking about earlier, the crisis stabilization or crisis receiving center type programs. How the funds are going out, where the ink has not yet dried on our legislative session. We'll actually know more probably by the end of this week how that's all playing out. But it's likely that there will be regional tables that will propose infrastructure investments at the local level, and then those will be reviewed for funds that are allocated to our state agency, the health authority, for review, and then allocated for ready and able builders. So that's going to be our approach going forward.
Thank you, Steve. Anyone want to add anything else on that? Actually, can we take the slides down? I think we'll put them back up at the very end for some more resources, but maybe if folks can see people. Thank you, Eunice.
Just a quick comment. I know that talking to folks in the Medicaid context around the country, I think the big question in terms of the influx of federal funds at the both state and local level becomes, how do you take advantage of those in a strategic way and not give them out in kind of a laundry list approach, so that you actually have some coordination in terms of how do you use those opportunities in the short term to build capacity, to increase the systemness in a system, so that you can then connect to what are the long-term sustainability funds. And the Medicaid funds may come more in that sustainability realm. And Steve earlier used the term braided and blended funding. I think the question becomes, how do you take advantage of these in a strategic way to build a system that survives beyond just the immediate term when these funds are available?
I was also going to add, Mark, I think having those shared goals can really help you too, because that can really anchor you in sort of what is success for us. And especially with these larger conversations that are happening across the country about what public health and safety means for communities, and having them participate, people who are most directly impacted be participated in those conversations. I think that can be a way to sort of try and bring the pieces together. So it's not just about, you're focusing on a population rather than just on a diagnosis or just on a specific model or just on a specific, constituency. And maybe that can help have the conversations. And maybe you have an existing initiative. I know we mentioned stepping up already. There are outcome measures and ways that initiative is helping to support counties in thinking through these questions. And so there could be, ways to tap into existing groups or initiatives or your counterparts, like connecting with your professional networks, or if your state has like a CCAP, something like a CCAP, things like that can also be helpful to not just be doing this on your own. So you're kind of joining forces too in different ways and still anchoring it in those overarching goals and outcomes.
Yeah, Alex, I just wanted to add very quickly too. In Pennsylvania, these discussions are ongoing now. We don't have our budget finalized yet, but I know that the counties have been pushing very hard to help the General Assembly understand the value of assuring that we have a strong base in Pennsylvania. We have base funding dollars for mental health services that really allow us to create a strong system, and that takes into account everything. The providers that we need to contract with. If we don't have providers, we can't do our jobs. If providers can't keep staff because payments are so low, the providers aren't of value to our constituents. So if those dollars in some way provide relief to the general fund, and additional emphasis can be placed in our state at least on these base dollars and to help solidify them. We haven't put anything new into them in more than 10 years, and they were cut dramatically back then. We think that that's a really important sustainable use, and it takes a lot of people talking to legislators and state agencies to make something like that happen.
Alex, if I may, just a couple other quick comments. Yeah, thanks. So, something that Mark said really triggered, my thinking on this is that as we think about the funding that will be available, some of what I think this funding can do is to fill gaps where we don't have the needed infrastructure for a seamless continuum of care. And, there are those gaps, and whether it be facility-based or workforce or data infrastructure, there's mobile crisis, there's just things that we don't have as part of an array of a toolbox. Another, though, is the system works, for better or for worse in the way that it does with the system partners that we have and the dynamics we have in place. And something that we spent a lot of time this session in talking about with legislators is how do we incentivize the system to work differently than it has to produce different outcomes? And I think this is especially a consideration where we're looking at health disparities and racial justice issues. And so we very deliberately, intentionally work to craft policies that can fund partner organizations that haven't previously been funded in the same way, who were essentially elbowed out because of often their small size or lack of current influence on the system. And I'm thinking specifically of community-based organizations. And some of these community-based organizations are really well tailored and positioned to serve their communities extraordinarily well. They have deep investment, deep history with these. They speak the language, they understand the culture, and and can have a really large impact if provided a seat, quote unquote, at the table. So as thinking about strategy, we think it's really important to think differently about funding parts of the system that may not have been funded before. And then also to one of Mark's points is that if we look at one-time infrastructure, like building out crisis centers or residential facilities, there's a tail to that, roll-up costs, if you will, are sometimes called. So in our large-scale investment package, the color of money there is about 50% general funds, which are ongoing, and 50% ARPA funds. So the one-time sticks and bricks investment can be supported by long-term sustainability of operational costs.
Thank you so much, Steve. Yeah, I got a question that I'm hoping we could get a very quick reaction to from our speakers, if you'd oblige me, and before we turn to resources. Someone asked about, for the various crisis response components, do you see the value or opportunity within that ecosystem for more innovation and use of technology that can help reduce adverse police encounters? I feel like that fits within this conversation of sort of your one-time investments that can then help you potentially down the line to leverage, within the mitigation conversation of the COVID funds. Is there any?
Alex, I would say yes, there's definite room for innovation, and just like we have seen in the past 15 months, really dramatic changes in the role of technology in our health system, telemedicine, telehealth.
Mhm.
I think that those are important considerations to move. I think they can reinforce some of the data and analytics that are available to our system for informing decisions. Just a word, I think, of caution in terms of Medicaid. Medicaid is a wonderful foundation for building a system, but also innovates slowly. And so if you want to engage Medicaid, recognize that that federal-state partnership requires some time. And so innovation may not move at the pace that particularly community levels want it to.
Thank you, Mark. Eunice, if you could just pop the slides back on for me. And then also while we're transitioning, I do think, yeah, there are some different like IT or innovative opportunities associated with each of these specific things. So, whether that's building out a system for more data collection and sharing with your public health department or with the CCBHCs to be able to connect with law enforcement in the field with people that are experiencing crisis. So I think that is a very good place to be thinking about how you can leverage these different resources in that way and thinking about that in a cohesive way. So it's not just creating, again, more silos that we already have. So I think just something to bear in mind. I know we had a lot of ground to cover today. I just wanted to really quickly, Eunice, if you could fly through to the resources for me. I wanted to take a moment to make sure that I can share with you some information of where can I get more help? Well, here's the answer. There is a Taking the Call conference that is going to be supported by the Bureau of Justice Assistance, and we're going to be digging into bringing together communities from across the country. We're encouraging that you bring a team. So encourage you, please check out this information. Please join us. We're going to be unpacking and trying to learn from each other of what happens when you take the call. Exactly what I think you said, Mark or Steve, like we all said this. What happens then? How these pieces have to fit together in order for it to work as a system. So please join us for that, where we're really going to be digging into community responder models and how to sustain them. And there'll be an ARP focus within that as well. And then the next slide, Eunice, if you don't mind, wanted to promote some upcoming webinars we have, one focused specifically on community engagement. And as that relates to community responder programs, we've talked about engaging people with lived experience, people who have been adversely impacted and further harmed. I want to make sure that voices are heard in part of these decisions and making sure that decisions that are made reflect the needs of the people who need those resources most. Next slide, Eunice. Also, please join us for our Justice and Mental Health Collaboration Program solicitation webinar, or if you're not able to join us, it will be recorded, but it is, the solicitation is out on the street. JMHCP has been a pivotal program over the years to help support communities in plugging some of these gaps and really helping build the resources that you need to be able to support collaboration. And so, very critical in this time more than ever. And so want to promote, if your jurisdiction's interested in applying for that, to go check those resources out. Next slide, Eunice. There's also another opportunity through JMHCP called Connect and Protect that focuses specifically on law enforcement and behavioral health. And you can find out more information about that later today as well. Next slide, Eunice. Yeah, next slide. We've got lots of opportunity. We're going to make these slides available too, so you can all see these. We have some new webinars. These are all linked at the bottom of your handout. But if you could just go to the TA centers, Eunice. Yes, I wanted to let you know if you have questions or you're not sure where to go from here, you can reach out to us. We have two technical assistance centers. One is the Center to Help Build and Strengthen Justice and Mental Health Partnerships. You can find all the information here. This is also supported by JMHCP. And there's another technical assistance center. Next slide, Eunice. This focused on law enforcement, but since this is all related, certainly you can go to any center and we will help you answer some of your questions. And then last but not least, if you could go back 2 slides, Eunice, I wanted to promote on the Justice Center webpage, we actually have, nope, one back. We actually have a resource all about ARP and we are updating it on an ongoing basis. So please check it out. If you just want a place to go to where you're like, oh, what's the latest guidance on this? We're doing our absolute best to keep up with that and to have things available in real time or as real time as possible. And then very last slide is my contact information. So you can contact us directly. So lots of different ways to get in touch. We hope that you'll join us for the Taking the Call conference. And please, yeah, let us know if other questions percolate or you want some help on figuring out what to do next. We can hopefully help you, or we'll do our best to try. And thank you so much, everyone, for joining today and also for staying a few minutes over if you can. I appreciate that. And we will make sure that all of the resources are available to you all. And just want to take a moment to thank my panelists who are very excellent. And it was very fun to be able to dig into this complicated, challenging, but a very exciting, potentially, series of opportunities. And really wish you all a very wonderful rest of your day. Thanks for joining us. Take care.